Welcome to Kara's Cures, where we explore the cutting edge of wellness. I'm Kara Sundlin, and today's episode is sponsored by the Center for Advanced Reproductive Services in Farmington. Today we're talking about how Chinese medicine, been around for thousands of years, can really help infertility patients. And I'm joined by someone who knows a lot about that. She is Helen Betke-Vargas. I want to say that again. Helen Betke-Vargas. She's an acupuncturist at the Center for Advanced Reproductive Services. Thank you for being with us, Helen.
Thank you. Thank you for inviting me.
You know, this is an ancient wisdom that I know has been used for thousands of years, but you're using it at one of the most cutting-edge centers for infertility in conjunction with other things, whether that be IVF, medications. How is this ancient wisdom helping women conceive today?
Yes, that's a very good question. First, I want to say that I was also an embryologist at the center from '84 for a good 2 decades, and then changed career to become an acupuncturist, and therefore brought more of my expertise into fertility.
Wow, yeah, that's an interesting background. You've been on both sides of the fence. So yeah, how does this really, how can acupuncture?
We know from many studies how it works in terms of like physiologically from Western medicine studies. As you said, it's ancient medicine. It's been used for many modalities, for many treatment of many things, including fertility. But the most recent studies in the past 3 decades shows us that we can tell that acupuncture helps improve blood flow to the uterine area to the pelvic, so improves. So therefore, we assume or make assumptions that because of more blood flow, that's why egg quality is improving, sperm quality is improving, and also it improves neurotransmitter production and endorphins, as well as balances the insulin. So those are components that through many studies that shows how acupuncture helps. In terms of, actually there's a new paper is going to be published because I'm going to talk more on psychospirit emotional level, how we can support our patients. And this paper will be presented at the ASRM, which is American Society of Reproductive Medicine in California. A colleague of mine, Dr. Lee Hollander Rubin, is bringing this paper about how it helps with anxiety while going through IVF. And that's a pretty important paper. Did I answer your question?
Yeah. Let me ask you, if part of this, you said you're an expert in the psycho-emotional part of this, and I know going through IVF can be very difficult. So acupuncture not only helps on a physical level, but you're saying it helps people stay hopeful and less stressed, which can really help.
Yes, because this journey can sometimes be very long, and these procedures can be sometimes taxing emotionally, especially. And this is another tool to support you so you can make best decisions, and you can, if it's a long journey, you can endure it better. We also know that meditation as well helps as well. So I bring all of it in the picture. I bring aspects of Chinese medicine, psychospirit level, which is called 5 spirits, which I train. I was blessed and very lucky to have studied with Laurie Deshar in that room. And from that perspective, I really focus on hope, on grounding practices like heart center meditation, and on really staying centered so you can make the right decision. So what is your intention? What is your plan of action? How can you stay grounded as you move toward these procedures? Hopefully you get pregnant sooner than later, but how can you stay aligned so you can make the best decisions at the right time?
And you come from the scientific world and now have moved into being an expert and even administering the acupuncture. So some people might not be familiar with this and say, well, why would I do this? I've already got so much on my plate. How are you incorporating it at the center, and how is it helping people?
Sure. So basically, acupuncture is implementing these very thin needles that are solid metal right under the skin. And the concept is to promote self-healing. That's the core of actually Chinese medicine. In Chinese medicine, under the umbrella, it's acupuncture, herbs, body work like cupping and gua sha, as well as meditative practices like qigong and breath work and nutrition. So acupuncture in itself has caught a lot of attention in terms of studies showing that it can improve the outcome of pregnancy by 30%. So that's a pretty, anything that can support you, it's a good thing to support bring the outcome to, closer to what you like.
Yeah.
In some of the side effects, I have to say, of acupuncture is that it's very relaxing.
Yes.
Often patients leave with a really calm state, and when I support them with these meditative practices, they also support them they take these tools home. I give them tools to do like every morning, every evening, doing some meditative practice, heart centering, which if you like, we can do a 2-minute heart centering meditation, which is really powerful. It's basically, is it okay to do that? There's a sound.
I know there's a sound coming. I'm just trying to figure that out. It was soft and now it's very loud. Oh, I'm not sure what that's from. It almost sounds like white noise to help babies sleep.
I can't hear you now.
Do you hear me now?
Yes, I can hear you now.
Okay, I think whatever it is, you fixed it with what you touched. So there we go. No worries. So let me ask you this. What's the protocol? How many times a week would women do this at the center? Can it be covered by insurance?
Yes, good question. Often I first do an initial consult. My office is actually down the road from the center, about 2 minutes. And the center sometimes offer where I can come there and do the pre and post embryo transfer acupuncture. Often the recommendation is a whole system. The studies, again, from Lee Hollander Rubin shows that a series of treatment, like once you know you want to do IVF or IUI, or even naturally trying to fertility, ideally you want to do 3 cycles of acupuncture treatment, best once a week, if time permits, otherwise every other week. Some of the studies I look to see, like, what is the minimal you can do? And I would say, based on Dr. Magarelli's studies and Lee Hollander Rubin's, it's good to do about 8 to 9 treatments before you go into retrieval, or
Before
as
the
well
egg
as
retrieval.
transfer.
Before the egg retrieval. There's that noise again, but well, it's really interesting to see the two worlds merge. I think so many people have had to have integrative care separate. Oh, I'm going to go see this person and that person, and then they go to their doctor, and their doctor doesn't know anything about it, and they're kind of doing everything on their own. So it's nice to see the center is integrating these practices.
And yes, that again, that sound is coming, and I don't know what.
I know. Well, you know what? That's okay. We got a lot of information out to the viewers, and I want to let people know they can go.
In terms of insurance, I have to say that some insurances cover acupuncture, some don't. So you have to know what your insurance you have, and that's where I give a form for a patient to sign and put it in.
Yeah. And people can call the Center for Advanced Reproductive Services. I know you've got some different convenient locations. The center is an academic affiliate for UConn School of Medicine, but you're located in Farmington, Hartford, New London, Brantford. I know you get some people from out of state, so if people are listening and you don't live in Connecticut, you can get lots of information at uconnfertility.com. Again, we apologize for some of the technical difficulties, but it appears the noise has gone, so that's good. And I was just going to say, it seems that it's nice to see one hand shaking the other of traditional, conventional docs working with these practices of meditation or ancient wisdom or supplements. And you're seeing that the science is bearing fruit, that it makes sense to do both.
Yes, the science is showing that it complements each other. That's why often they're called complementing, alternative medicine. And there are many studies. Again, the studies are on my website if anybody wants to take a look at them. it's good to be informed in what way acupuncture help. We also know that, again, from more recent studies, that acupuncture in early pregnancy reduces miscarriage rate and supports the well-being of the new mothers.
Oh, that's interesting. So it does reduce miscarriage rate. That's nice to know. And I know it's something that women have been dealing with a lot. So I guess, like anything, you want to make sure you're going to a qualified, licensed acupuncturist like yourself. Interesting that you also have that background of being an embryologist. And I did mention UConnfertility.com, but also, for sure, shout out your website so that people can get in touch with you, Helen.
Yes, it's acupuncturetreeoflife.com. That's my website.
Yep, acupuncturetreeoflife.com. And you said, if I heard you correctly, it's about 3 times a week is ideal. If you can't make that happen, you might do some less.
Yes, it's often 3 cycles of like 3 months, 3 cycles of treatment once a week, ideally.
Oh, once a week, 3 cycles, meaning 3 months of a woman's cycle.
Yeah, once a week treatment, 3 cycles is ideal.
Okay.
And a more recent study shows at least if you can get to 8 or 9 treatments before your IVF, it gives the best results.
Okay. And again, you've got those studies right on your website, so if people are interested. The nice thing about acupuncture, can you just speak to the safety? Some women might be nervous, like, oh my gosh, I'm going to put needles in me. Isn't that dangerous for the baby? These are paper-thin needles, but just, allay any fears of, could this have any ill effects?
Yes, no, there's, it's one of the safest acupuncture practices by licensed acupuncturists. You make sure you're going to a licensed acupuncturist who have done at least 3 years of training and continuous training as well. The needles are very thin, hair thin, and they go right under the skin. So the safety, and we use one time, sterilized needle, just like any other medical grade products. And you can also check, in terms of, people ask, is it painful? It's no more painful than plucking your eyebrow, or some points you actually don't even feel. And sometimes I say you may feel like a little mosquito bite, but immediately it goes away. Often once the points are in, we let you sit for about 20 to 40 minutes, and it's a very relaxing. Often patients leave with a great sense of energy, good energy, feeling like your cup is full in terms of energetically as well.
Yes, yes.
And
that's what I've experienced. Sometimes I fall asleep.
As well, it's used, many people use it for back pain, shoulder pain, migraines. That was my doorway to Chinese medicine. I had terrible migraines, and an acupuncturist within 3 months really eradicated my migraines. So hence my interest in it.
Wonderful. Well, Helen, thank you so much for sharing some information with us and making sure that women know that there are these extra things they can do that can really support them in the spiritual, emotional part of the journey to become a family. And it can also help your efficacy. So thanks for being here. And again, you can go to UConnfertility.com. You can also go to the website, treeoflife.com, that Helen mentioned, something perhaps to consider. If this is helpful to you or someone that you love, be sure to share it. You can follow me on social media at Cara Sundlin. I do like to share this content there. You can also join the CURES Facebook group at CURES. Have a great day and be well.